A common question I get about hormones and hormone replacement is, why do we take DIM? So DIM is a supplement, has a really long name, I'm not even going to try to say it, but it is an extract of cruciferous vegetables such as cauliflower, Brussels sprouts, things of that nature. And what they do is they help the body stop the conversion of testosterone to estrogen. So that is the natural course of things in our bodies. We produce DHEA, produces testosterone, then turns to estrogen. So that's normally what happens all of our lives as long as we have the base ingredients to make the beginning of sex hormones. So when we are supplementing with bioidentical hormones, we want you to have the exact amount that you're supposed to have. So the testosterone to stay as testosterone, the estrogen, if we put any in, to stay in the estrogen, and not to have bleeding back and forth. And so the reason for the DIM is that. So very often people will think, oh, it's a supplement, I'm not really noticing any changes. Well, you won't notice any changes until you don't take it for a while, and then you'll have signs of estrogen overload, which can be signs of like PMS, so crying, being overly emotional, nipple tenderness in both sexes. These apply to both sexes. Some belly gaining, some bloating, just some really kind of unpleasant side effects. And so whenever you're doing hormone therapy, it is really important to take the supplements that your provider recommends, because there is actually a reason for them. Your health is always our primary concern, and we want you to have the very best optimum results.